Hi, this video is for users of BP Premier and will demonstrate how to add a coded diagnosis to the patient's medical record. The term coding refers to selecting from a list from within the software. What is coded we can search for, and this process has many clinical safety and efficiency benefits, which I will explain at the end of this video. To add a coded diagnosis, you can go to the past history section on the left-hand tree in BP Premier. Select the Add button and enter the date information if it's historical, or click today, and then search from the coded list. In this example, I'm going to code the diagnosis of COPD. I can start typing a few letters, note the appearance of the list, double click to make your selection. On the right hand side, we have the options of mild, moderate, severe. Is this an active condition or inactive? Only significant inactive conditions or events would go on this list. Importantly, we can add further details to make this more helpful as we share with other treating clinicians. For example, who's part of the care team for this patient? Who is a specialist perhaps looking after this condition? What are some detail about that condition that makes this more helpful? There's a tick box to send to my health record. There's a tick box should this be confidential and perhaps not to be included on all summaries. There's a tick box to include in summaries, and also if this is the reason for the visit today, and save. Note we have active and inactive problems. On the list, this patient has rheumatic fever. I can edit or double click to edit, and here we have the notation that the last echo was in 2000 and that was normal. So this is an inactive condition, and save. So chronic conditions, inactive and active, and significant events. Another way you can add that diagnosis is within today's notes, so within the consultation, and then we have a diagnosis button. There is a tick box to add that to the past history. Just be careful when adding a reason for visit. While a reason for visit is especially helpful and helps us track in the past visits, not all reasons for visits, for example, a care plan or a sore throat, need to be added to that past history. So you make the decision if it's significant enough to go in the patient's past history. Add, edit, delete. So this past history list is shared from BP Premier to referral letters, to care plans, hospital admission letters, and on summary sent to my health record. So coding is vital. Free text type conditions can be ambiguous to patients and also to other clinicians treating patients. So it provides clarity, it improves helpfulness if we use that further detail section also. Coding may also help our patients in regard to preventive health and quality improvements. It allows us to identify our patients at risk. It allows us to identify patients with chronic conditions and create disease registers, for example, COPD or diabetes or heart disease. Then we can more efficiently implement and manage recall and reminder systems. Coding helps us identify care gaps and proactively work to improve the health outcomes for our patients.